The streets of El Paso are empty as the city's funeral homes struggle to find space for the dead. A 10th morgue truck has been requested to hold the bodies of people dying faster than can be buried.
Unfortunately, in my field, mortality is a fact of the profession. The numbers, I think the numbers of people who are now having this outcome is what is really being most hard for us, all of us in the community, to absorb.
The population of El Paso is 680,000, yet more people are hospitalized within this desert city than the totals in most U.S. states. This parking lot is now a COVID overflow wing. The downtown convention center is a field hospital, and doctors and nurses have worked without rest, calling on colleagues from around the state for help.
We are now basically outsourcing to be able to do it. And I think that's what, on the good side, has been fortunate that we're getting a lot of support.
Helicopters are now transferring COVID patients from El Paso to emergency rooms across the state of Texas, to hospitals in San Antonio, in Dallas, and here in Houston, 1,200 kilometers away. Doctors here say they are treating not only those El Paso COVID patients, but also bracing for another influx of their own.
We got to change that. We have to stop that because all of us, every person, healthcare team member, we are tired, we are exhausted.
But doctors say there is no relief in sight and that conflicting government orders are largely to blame. El Paso's county executive ordered a lockdown in late October, only to have the city's mayor refuse to enforce it. Then the conservative state government of Texas said the lockdown was illegal, after which a court reinstated the lockdown order.
Every day that the county's order remains in effect is another day that we can save lives.
This region bordering Mexico abounds with large, multi-generational families. Previous infection spikes have followed holiday gatherings, and Thanksgiving is around the corner. Andrea Cortez is among 15 in her family who contracted COVID.
So it was a domino effect. My uncle got my grandfather got my grandmother got my mom and my uncle, and then my mom got my father and my siblings and I sick.
Her grandfather did not survive. Now he's among the more than 700 people in El Paso who've died of COVID, joined by more souls each day. Heidi Zhou-Castro, Al Jazeera, Houston.